Hi, my name is Dr. Kirtishri Mishra. I'm the Director of Reconstructive Surgery here at Metro Health Medical Center. Today, I want to take the opportunity to talk to you about Peyronie's disease. Peyronie's disease is a condition that has increasingly become more visible within the community, and I've seen in my practice more patients coming to talk to me about this condition. Peyronie's disease is a condition where an individual may form excessive scar tissue within the shaft of the penis that may lead to curvature and may limit an individual's ability to achieve penetration and be sexually active. In addition, there's some evidence that says that it can lead to erectile dysfunction as well over time. The exact etiology of Peyronie's disease is not well understood. However, some theories postulate that it may be because of an isolated trauma to the area that may have led to the initial scar tissue formation, or there may have been some underlying erectile dysfunction followed by subsequent microtraumas that led to scar propagation. Most of the times, individuals who experience Peyronie's disease are individuals above the age of 40 and may have some degree of underlying erectile dysfunction. However, there have been correlations shown with another pathology, which is called deputrans contracture, where an individual develops a trigger finger, and the pathology is thought to be of similar sense. Not receiving treatment for Peyronie's disease over long term can have both physical and emotional effects. Physically, an individual may not be able to be sexually active, as well as over time develop persistent erectile dysfunction. In addition, the emotional distress caused by Peyronie's disease can have an impact on the patient as well as their partner and have long-lasting mental effects as well. The active phase is often the time when an individual experiences pain with erection, or even without erection sometimes, as well as change in the curvature. Stable phase is often described as the time when there's no pain and the curvature has essentially stabilized at a consistent point. The treatment option for your Peyronie's disease needs to be discussed with your provider, because often we have to take into account the severity of the disease as well as your baseline erectile function. 4 different options for treatment of Peyronie's disease are traction therapy, injection of collagenase or Xiaflex is the medication, plication therapy or surgery, and lastly, insertion of a penile prosthesis. Traction therapy is a mechanical intervention where a device is placed on the penis and it pulls on the distal or the tip of the penis, as well as in a direction that allows the curvature to be stretched and the scar tissue to break down over time. This can be time consuming, however, it does avoid a surgical procedure. Collagenase injection, or Xiaflex is the name of the medication, is an injectable but in-clinic procedure where multiple cycles of injections are performed into the plaque, and the patient is taught how to perform modeling at home to assist with breaking up the scar tissue. Plication surgery is a surgical intervention, meaning you will have to go to sleep under anesthesia, and the idea behind plication treatment is that if an individual has curvature to one side, then sutures are placed on the opposite side to bring the penis back into a straight position. It's a same-day procedure, and you go home, but you still need to have somebody drive you into the hospital and take you home. Plication therapy is a good option for individuals who have good erectile function and have an isolated curvature. Finally, the most involved part of the treatment cycle is placement of a penile prosthesis. Generally, we place an inflatable penile prosthesis, and this is often a good option for individuals who are not only suffering from curvature but also have issues with erectile function. The penile prosthesis is a surgical procedure, meaning you will receive general anesthesia, and through a single incision, we place the entire device, which is concealed on the inside, and when deactivated, the penis is flaccid. However, when activated, it straightens out the penis as well as allows the individual to achieve a good erection. On the day of your visit, we'll talk about your disease presentation as well as discuss the next steps. Often the next step may involve performing an artificial erection in clinic, where I inject medication into the penis and allow the curvature to be fully demonstrated for me to determine how we can best proceed. In addition, you'll receive this pamphlet in clinic, which will give you all the information that we discussed here, as well as a QR code so you can watch this video and have any further questions on your subsequent visit. We look forward to being able to take care of you, and we'll see you soon.